Welcome to Voice of Care. Coming up in this episode, I'm speaking to Pauline Shepherd, Chief Executive Officer at the Independent Health and Care Providers in Northern Ireland. Northern Ireland is undergoing a tremendous amount of reform in social care, and we'll be discussing the role of the independent sector amidst a workforce crisis that needs urgent attention.
We don't have enough people to actually provide the care for that rising number of older people. So we need to think about more innovative ways of providing care, or indeed early interventions that prevent people presenting in hospitals. So we need to fix the social care, because basically it's the foundation of the health system. Let's be honest, the high percentage that's being provided by the independent sector, it's only been provided by the independent sector because it's cheaper to do it than it is in the statutory sector. So there has to be some consideration of, let's be fair, let's be open, and let's be honest about that. We need to find different ways of actually meeting. There's a high unmet need in Northern Ireland in terms of social care, and we need to start thinking a bit more innovatively.
Hello, I'm Suhail Mirza, and welcome to this episode in Season 2 of Voices of Care. I'm joined today by Pauline Shepherd, CEO at Independent Health and Care Providers in Northern Ireland. The Voices of Care podcast seeks to get to the heart of the issues facing the health and social care sector and how we can enable the healthcare workforce of the future. In this episode, I'll be discussing the reform of social care in Northern Ireland and the crucial role the independent sector is set to play. And who better to talk to me about that than Pauline? Thank you very much for coming over and seeing us, and welcome to Voices of Care.
Thank you. I'm delighted to be here, Suhail. Thank you for inviting me.
It's our privilege. Now, it's a transformative time for adult social care. The Department of Health has completed its consultation and reported. But before we go into some of the findings and recommendations, perhaps you'd be kind enough, you've been nearly 10 years at the helm at the Independent Health and Care Providers. Perhaps share a little bit more about what the role of the organisation is.
Yeah, we're a very small organisation, Independent Health and Care Providers. We represent the independent sector of all providers that provide care in care homes, home care, or what's commonly called domiciliary care, and daycare services in Northern Ireland. And our members come from private sector, not-for-profit, church affiliated, and other members, provided they're not statutory providers, they're welcome to be our members.
And you're part of and play a very important role UK-wide, I think, in terms of the agenda around social care. You have associations with the Home Care Association and, of course, the Five Nations Care Forum.
Yeah, we're part of the Five Nations Care Forum. So together, we lobby on behalf of the whole sector across the UK and Ireland. And we try to encourage the appropriate funding. We look at strategic issues. We all have similar issues like recruitment, retention difficulties. So we try to influence, learn from each other, and actually try to influence and lobby for change within the social care sector.
And that lobbying for change perhaps has never been more important. Now, Northern Ireland's had a number of interventions over the last decade looking at the sector. You yourself have gone on record as saying it was in deep crisis. Back in 2019, the People to Power report was published in 2017, highlighting the fact that the sector needed urgent reform and attention. Can you paint the picture about the sector, please, for us? Because we have seen in England, Scotland and Wales a similar theme. Northern Ireland, it's around the population changes that are taking place, with the over 65s and over 85s growing quite rapidly, and a drop in the number of people of working age.
Yeah, it's a complex. It's like any of the nations that are involved in this. It's a complex area, and really there's been lots of reports. There's been many reports over the period of time that I've been in the job that I'm in at the minute. But basically, we all know what's wrong. We all know how to fix it. But there isn't the funding and probably the investment that's needed to actually fix it. And social care has come sort of second in line whenever there's funding available. So COVID has brought the social care sector to the fore, because social care, in particular care homes, were badly impacted and remain impacted by COVID, and probably will remain working in a different way than they were post-COVID. So really, the demographics in Northern Ireland are a significant contributor to the reforms that are needed. There's about 2 million population in Northern Ireland, and the estimate is that by 2040, the requirement for social care packages and social care interventions will increase by about 80%. And we don't have the profile of young people coming through, so we don't have the workforce. We don't have enough people to actually provide the care for that rising number of older people. So we need to think about more innovative ways of providing care, or indeed early interventions that prevent people presenting in hospitals. So we need to fix the social care, because basically it's the foundation of the health system.
And you say it's sometimes the poor cousin when it comes to funding. That's in comparison to health,
yes,
for example. And I know that the former Health Minister, Robin Swan, said social care is every bit as important as health. But we're not seeing that in terms of the large number of vacancies in social care, which also has an effect, I think, on the pay levels, of course, within the sector.
Yeah, I mean, there's no central location that actually collates the vacancy levels within the social care sector. And within the independent sector, I rely on members advising me of, problems with vacancies, problems with having to recruit high numbers of agency staff that cost somewhere between 2 and 3 times the normal hourly rate. But obviously, it varies. Cities and larger towns in Northern Ireland would have more of a problem to try and recruit and retain people, because where you have other, large retail, businesses or large hospitality, they will poach the staff from the sector. Rural areas maybe don't have as big a problem because there maybe isn't the same, there's a different catchment area, and there are more people available who want to work in a care environment. So locality has something to do with it. But some of our members are reporting very high turnover of staff, particularly in home care or domiciliary care, where people will join an organisation, but maybe after 2 or 3 months they realise how challenging the job is. So there's a high turnover around the 3-month period of employment.
And that's quite important, because much of the debate around Northern Ireland, and indeed across the UK, of social care focuses on the cost of providing these services, which are commissioned and contracted. I wanted to step back a little bit, because you have an eye through your members at the bigger picture, not just the independent sector, the whole of the sector. It's a source of important contribution to the economy, employing large numbers of people. And I think one of the goals that you have in the organisation is to promote social care as a sector for people to work in.
Yes, I mean, there's 480 care homes in Northern Ireland, and of those 480 care homes, 16,000 beds, 15,000 of them are in the independent sector. In the home care side, there's 240,000 people every week looked after in their own homes, wow, and 72% of that's home care. So it's a massive employer. We're talking around maybe over 40,000 people in Northern Ireland employed in the sector. So, we do need to try to attract and retain people. So we need to actually look at, it's not only about increasing their wages, because increased wages won't completely motivate people. We need to look at reducing the pressure. We need to look at the number of 15-minute visits that there are in Northern Ireland is significantly higher than across the UK, and that's burnout. We also need to look at the trauma of people working in the sector through COVID. There's been a lot of people have been traumatised, and they need help, they need support. But one of the issues is that we need to look at maybe more innovative ways of recruiting young people, encouraging them at school, colleges, that it's a good career to go into, but maybe looking wider at than that, looking at people maybe that have retired, would be happy to do a few hours a week. So look at different pools to actually recruit people from.
And also there's an element which we have touched upon in other podcasts around the importance of international recruitment. Now that does offer tremendous support, but it's not a panacea, and also it depends on the sector, does it not? It
depends on the sector. I mean, there's lots of international recruitment going on. We have increased the number of recruits from other countries, and it seems to have worked okay in the care home side. Home care is having a bit more difficulty, because obviously we need to have driving, we need to have the driving licences, we need to have people more mobile, and that seems to be a bit of a barrier that we can get social care workers and nurses, but in the home care side there is more of a challenge.
But again, that will be partly, it's not about pay only, but it's also about the proper funding. So I think the Power to People report 2017 did invite and actually exhort policymakers, so that we need to be, I think the quote was, we need to be honest about the true cost of care. are politicians being honest enough about that true cost?
At HCP, we've been lobbying for many years, probably 10 years now, to actually say we need to identify what the true cost of care is. And I know there's been work done in England on that, but we need to identify it because we continually, I suppose, have this discussion with the department where they're saying, well, there's lots of investment in the sector. Obviously, you're doing very well. And in my view, there's a wee bit of an elephant in the room there where we need to actually identify, well, how much does it cost? And is it fair to be saying that, people are investing and therefore there's money to be made? And in Northern Ireland, we've gone as far as actually saying, well, let's look at the cost of care, but let's look at, if you're concerned about profit, let's look at putting a market regulator in place. And going as far as that to actually say, well, what is an appropriate profit here? Because let's be honest, the high percentage that's being provided by the independent sector, it's only been provided by the independent sector because it's cheaper to do it than it is in the statutory sector. So there has to be some consideration of, let's be fair, let's be open, and let's be honest about that. So the true cost of care, is a very important factor in trying to, get the evidence of what investment's needed. And we also need to look at it's not just the cost of care, it's the contribution of that care to Northern Ireland's economy. And when you look at even the likes of unpaid carers, there's an awful lot of unpaid carers. And it is a low cost that they're paying to home care and care homes. And if that wasn't there, that would be costing the health service considerable amounts of money. So there isn't the comparison of, if we didn't have these services, what would the real cost be to society?
A lot of work to be done then. I think Des Kelly, John Kennedy in their report, Power to People, did quote research back then from the University of Ulster saying that the gross value add economic contribution of social care was in excess of £300 million, probably greater now. I want to turn to the actual workforce and in terms of how you're currently doing and what you're seeing as good practices, because the work around leadership is really important. The Department of Health's consultation, Power to People, one of its key recommendations around a valued workforce centred on the idea that the single biggest factor of quality of care and outcomes is the quality of the management. And I think you're playing quite a big part in promoting leadership and finding a means, I think in collaboration then with Ulster University, of facilitating that leadership.
At ICP, we've done quite a lot in the last 10 years or so in terms of we joined forces with the Ulster University and AGNI, and we funded the first cohorts of care home managers in Northern Ireland to go through the My Home Life programme. My Home Life programme, as you probably know, is an international leadership programme, and we funded that at the start. We funded the first few years of cohorts. We work in partnership with the Ulster University, and so far now that's been running for the last 9 years or so, and we've had about 12 cohorts of staff through that, and we've made a lot of progress in the last few years in influencing the department to join with us in the My Home Life. And in the last year the department have funded going forward, I think it's about 4 or 5 cohorts now, and they're seeing the benefits of that. It's giving care home managers a lot more confidence. It's giving them the network of communication with other care home managers that they can share and they can learn from, they can develop best practice. It has been a really worthwhile programme. Other things that we've been doing, we've been working with the Northern Ireland Social Care Council, work in collaboration with them. They've been really good about doing videos with our member staff to encourage, attract people into the sector, demonstrate how good the social care sector is. So we've been working with them as well. So there's lots of good practice going on there. And we've also been working with the department more recently. We've influenced them to implement the Social Care Collaborative Forum. So there's lots of good activity going on there. And I suppose the final thing, we're about to launch in November. At CP, we've developed an employer charter where we're going to ask our members to volunteer to sign up. It's a good practice, it's best practice, basically outlining how the issues about being a good employer, employment law, grievance procedures, good recruitment, good support, health and well-being, all of those elements within that. And we're going to launch that from Stormont on the 22nd of November.
No, that's an array of work, and as you say, tied back to good leadership in care homes in particular, hopefully will drive better outcomes.
Yes.
And as you say, promote the sector. One of the things you've talked about, of course, we'll come back to in looking at the future and the forum that you mentioned. But before that, obviously, the need to grow the workforce is there, but also to retain the workforce that is there. Pay and conditions and career pathways are there, of course. A couple of other factors, and that's inclusion and wellness. You've touched upon wellness, but going to inclusion, the demography of Northern Ireland is changing. From 2001 to 2021 census, quadrupling of people from ethnic minorities. So perhaps you can speak a little bit around how that's going to impact your members and the sector as a whole, because of course the workforce has to represent that changing demography.
And not only representing that in terms of the workforce, representing it in terms of the clients and the service users that we deal with, and actually encouraging people to learn about cultural differences, to learn about ethnic differences. So yes, there's programmes in relation to that work as well. We need to recruit a lot more from ethnic community, and that's part of our employer charter, to look at recruiting on the basis of in social care. It's not about learn your skills. It's not about your educational qualifications. It's about your personality. It's about how empathetic you are. It's about your how you relate to other people. So there's a lot of it based on a person's, I don't even know how to describe it, but a person's competences in relating to other people, their interpersonal skills. So that is the baseline, and that's where everybody should be recruited from. You can be trained up to deal with the various elements of caring, and that should be, we should be recruiting from anywhere within Northern Ireland and outside Northern Ireland where we can get those skills and attributes from.
It's people need to sometimes sit back and think there's a lot of growing complexity required from care workers, but it remains a quintessentially human and quite intimate endeavour, what you're referring to. On the wellness side, you talked about some of the support that has happened. Now, Ulster University has been continuing a study since COVID looking at the effects on wellness of the whole workforce. In its latest report earlier this year, talked about the fact that 50% of health and social care workers have reported a fall in their workforce well-being, 40% of those are thinking about changing careers, and if there were three things employers could do, one of them, 41% said, would improve well-being provision. Can we talk around that? Because where people keep talking about the post-COVID period, but it feels as if it's very much within the DNA of the workforce and society.
Yeah, that's interesting, Suhail, because one of the issues we do in HCP is we run webinars for our members, but we go out and actually ask them, what are the issues that you would like to see? What are the topics within webinars? And when we went out about 6 months ago, the biggest and the greatest number of requests came about resilience, and we thought, well, that's really interesting. That resilience is one of the things, and that was coming from through the COVID, that people felt weary, they felt tired, they didn't know how they were going to cope. So we've run webinars, and we're looking at how can we maybe develop some programs around resilience. So we've done that, but also within the employer charter, we're encouraging our members to sign up to health and wellbeing, health insurance, employee assistance programs, and many of them already have that, to make sure that there's counselling support for staff when they feel under pressure. They can go somewhere either within the organisation or outside the organisation. During COVID, we had a really good relationship with the Department of Health and the health trusts, and their psychology services provided direct input psychology support to care homes that were facing multiple deaths from COVID, and that whole trauma around that. So we've had really good support from the Department of Health, but we now need to make sure that that's embedded and that that can follow through, because as I've mentioned earlier, we're not through. COVID yet, and we can see already in the last few days increasing numbers of a variant. So we're not through all of this, but we need to provide the support, rebuild that workforce, reward them, recognise them, and make them feel valued and supported.
And I think that work will continue in terms of the collaboration you've talked about. I wanted to have the final section today to look ahead. Hopefully, all of you, I'm sure, will be hoping there will be some tangible results coming out of all the consultations and the summary report that the Department of Health published in June this year. Can you elaborate on some of the work in terms of that you see in the Social Care Collaborative Forum? Because there are a number of work streams that flow from that. I wanted to highlight technology and innovation because that's going to be vital if you're going to deal with a demographic challenge that you've talked about.
The Social Care Collaborative Forum has been running now for a few months, and there's lots of work streams from it, as you say. The first one probably is the biggest priority in terms of trying to fix home care services, and in particular about hospital discharge pathways. But there's a number of strands, and the one you've mentioned there is the technology, innovation, and we need to find different ways of actually meeting. There's a high unmet need in Northern Ireland in terms of social care, and we need to start thinking a bit more innovatively. The likes of when you ask why is there so many 15-minute visits in Northern Ireland, and you dig below that, is it because somebody's just getting a call for medicines administration? Is that all they need? Could that be done by a medicines dispenser with the proper controls around it? Pharmacy are able to do that, but they're high cost. But the high cost is needed up front for a longer term investment. So there's invest to save issues that we could do. Now, I don't mean about taking away home care, that the human interface is very important, but I do think that we need to start looking at the older people in society and how we can keep them healthier, because people turn up at hospitals who maybe have had self-administered the wrong medication. They turn up because they're maybe dehydrated or haven't had the proper nutrition. So there's lots of things that we could be doing early intervention to prevent people actually presenting at hospitals. And in my view, home care services, they're the eyes and the ears out in the community, likewise GPs. So we should be using that resource more to actually identify, are there people out there who haven't yet come on the radar, but we could maybe keep them and help them more healthy, and therefore reduce the need for the increasing number of later interventions.
And that would of course require better use of data, more visibility of data, and technological innovation you've talked about. The key to all of it, I think, the golden thread running through what you've said goes back to, I think, two of the priorities that struck me from the Department of Health and the report Power to People, which is the importance of the primacy of home, which you've discussed, but that's got to be built around a valued workforce. And I think maybe we should perhaps end on that subject, because you've talked a lot about the vital role it plays and how we can do more to promote it as a career over the coming years. Are you seeing that begin to happen at schools and the wider community?
It's at early stages, and we have been looking at it for some time. It's about trying to, I suppose, mobilise that. Where do we start? And starting at schools, that's going to be a long time before we actually see any benefit. And as I mentioned, it might be better to start looking at other pools of people where we could, call people in. So we need to start maybe thinking about things like that, as well as the technology, the innovation. And it's probably an issue that needs to have lots of different ways of getting into it. And there's lots of actions around it that maybe would get it in the right direction. But we really do need to, first thing, pay people appropriately, and we need to get that we are not in competition with retail and hospitality, because the jobs in social care should be paid at a higher rate than that. So we need to get off that market level, and then we need to encourage people to say, you've got a job here, but you also have a career, and show a pathway through. And
at the same time, I guess the other side of that equation that you referred to, get the data to understand the true cost of care, because I think one of the key work streams from the forum is also around contract and commissioning.
Yes.
Have the data so that the contracting and commissioning is at such a level that can facilitate this growth that Northern Ireland needs over the next 25 years.
And that's exactly right. I mean, the contracts for particularly in care homes in Northern Ireland were last reviewed in 2014. So, I mean, the contract no longer meets the care, the regulations and the standards that are in place that care homes are measured against no longer really relate or reflect the care that's provided. And going forward, we need to have a method of actually identifying, well, what are the care needs? What are the dependency levels? How do we provide care to meet those? What's the cost of delivering that? What workforce do we need? And how are we going to pay that workforce? And how are we going to actually, have that social care system in place going forward? Because we are facing a particular difficulty in Northern Ireland with the ageing population.
Looks like you'll have plenty on your plate to do over the next few years. On that note, Pauline Shepherd, thank you so much for your time and your wisdom.
Thank you very much, Suhail. Thank you.
My pleasure. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to find out more about how we are enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much and look forward to seeing you on the next episode.